restrictions are being reduced across the country, the New South Wales Government have introduced new rules surrounding public transport.
We don't want people to either get the virus or spread the virus on public transport. There'll be deep cleaning, there'll be extra measures in place. There'll also be special identifications of where you should be sitting or standing on the mode of transport, so you'll have that advice as well.
Under the new restrictions, just 600,000 people can use the network each day, but given it usually services 2 million people, how's it all going to work? Joining me now, New South Wales Minister for Transport and Roads, Andrew Constance, in Sydney. I tell you what, Minister, sometimes you must think that somewhere last year you ran over a black cat because you had the fires and now you've got this. Well, I think we're all with you on social distancing. How are you going to make it work?
Peter, can I give 2020 back? I mean, seriously, like, it's just an absolute shocker. But
it's a shocker.
Look, you know, I mean, I guess the main thing is, like, we've got a transport network that carries 2.2 million people normally. We've seen a lot of people working from home. That'll continue, particularly as schools go back and they don't have to homeschool and work from home at the same time. So, you know, we've got this challenge. I don't want to see a repeat of what we've seen elsewhere around the world where mass transit has led to, you know, obviously an upsurge in infection rates and what have you. We've got to be careful with that. And this is going to be a step-by-step change. And we'll just keep an eye on it. We've got data available by the truckload. We're monitoring all our services, all our train lines. We just want to keep people safe. And if people maintain that 1.5 metres, avoid the peak, we're going to have overflow car parks around the city, knowing that people are increasingly driving, then we can give a good shot at this over the next period of time to make sure that we don't see an upsurge in the infection rate. And that's what it's about. I know it's inconvenient, I know it's tough, I know that the pitfalls with the transport network at the best of times, but we ultimately right now are entering a phase, I think, with the pandemic where we just don't want to see an upsurge, a second wave of infection, and I certainly don't want transport to be the catalyst for that.
Oh, look, I think people support you. I think this just makes another complication on an already complicated couple of months for people. But how long are we talking about? I mean, is this all until we get a vaccine, if we get a vaccine?
Look, I think the first thing is that monitoring it, you know, week by week and seeing how people are responding. I mean, people are changing their habits. People are opting, obviously, if they're in the inner city areas, to walk increasingly or ride a push bike. People are opting to drive, although we're still not back to the pre-COVID levels in terms of motor vehicle movements across our global city here. So, you know, we've got means and ways to monitor it and monitor it carefully. We're providing information on a daily basis to commuters through the smartphone applications. And we've also set some guides in terms of the actual transport network itself. So, you know, green dots being applied across in terms of those decals on seats. Same time, we're doing intensive cleaning, and we're just trying to encourage people to take some responsibility and not see bottlenecks across the network where we see excessive crowding of people and the risk of the spreading of the virus.
Right, what about masks? I mean, some countries around the world are making masks mandatory, particularly on transport, yet we're not doing that in Australia. Why not?
Well, again, we're guided in terms of the health advice on this. I think it's fair to say that there was, you know, right through this process, you know, the need to ensure that surgical masks were available for our health professionals. Again, it's a watching brief, but because of the low rates of infections, we haven't received that guidance. There's no doubt it'll be looked at by the Chief Medical Officers. We'll keep a watching brief on that. But the main thing I think people can do is that if you've got a runny nose or a sniffle, don't go out and get public transport. Go and get tested. And I think we've got to rely on each other a bit here. We can't just have government telling everybody what to do and how to do it all the time. We just need people to also, you know, be kind to each other, be patient, particularly on transport networks. But, you know, if you're not feeling well, do the right thing by yourself and your family and
yeah, oh, that's a no-brainer. But why don't we say to vulnerable people? Why don't we say, well, look at the people that are working in nursing homes that should know that more than anybody, and they're turning up to work. But I mean, why wouldn't we think about perhaps thermo-testing people? You know, if they have a fever, they can't use public transport. I don't know how you do that with mass movements of people efficiently enough. probably going into trains you could, buses harder. But what about saying to the vulnerable older people in the community or those with a comorbidity, don't use public transport, and perhaps then you could put more people on the bus? Is that possible?
Well, look, we're doing that already in terms of that cohort of people. I mean, the message is very clear to stay home and not risk your life out and about in the community. You know, this is a real challenge. It's a really dark time in terms of this, and I'm not here to lecture people. I mean, I just think at the moment we want everybody to work together. And you know, the thing about transport in particular, if you look right across all avenues of life at the moment, where we're going to see a concentration of people at this time, unfortunately, is public transport, which is why the Premier last Friday said and urged people not to travel during the peak. The same, you know, recommendation in terms of those with comorbidity and obviously those who are susceptible in a mortality sense, particularly with this virus. Please just be mindful of the dangers. And, you know, we've also, you know, ultimately we've got to open up this country again. We've got to get it going again. And transport has an important role to play in that. I think that's the key message I would like to indicate. I mean, we're providing guidance. We're not, you know, putting in place public health orders in relation to physical distancing on trains and buses. We're just trying to get people to do the right thing by themselves. Our operators, our frontline workers, our bus drivers and train drivers are doing an amazing job.
Yeah, and we saw in London too the number of public transport drivers, conductors and other things who got coronavirus and ended up losing their lives. I think the number I saw was around 50. I want to ask you about school children, because is there a directive that you can't leave a school child, you know, at a bus stop if then you've got to take them and you exceed the number of passengers? How do you make that work?
Well, again, I mean, most of our school children have been encouraged, particularly through school communities, to get parents to drop them at the school gate via motor vehicle, particularly at this time. We have specialised transport services for school kids in the main. But I don't think anyone would begrudge the important task of picking up a single school kid on the side of the road on a bus stop. We can't have children left on the side of the road. So there's got to be a degree of common sense and practicality around this. And that's why, certainly in terms of, you know, our bus drivers, they'll be picking up school kids. And ultimately, they'll be prioritised over adults in that sense. And I don't think anyone would begrudge being a little bit late for work just to make sure that a school kid is picked up on the side of the road and not left there.
Well, I haven't seen you since Eden Monero. No regrets there for pulling out of the race?
Yeah, look, I said what I did a couple of weeks ago and I've been silent since. You know, it's going to be a hell of a tight race. And, you know, when I weighted up at the time, 2 by-elections, state and federal, and, you know, the need for absolute unity, it played on my mind. And Jen and I spoke at length that night before I did pull out. But, you know, the thing about it is that I've got a hell of a job to do right now. And I believe that certainly in terms of, I've had my head down and just trying to get this right. And that's where I'm going to continue my focus, you know, the fire recovery, obviously COVID, and play my part. I haven't got time for the political games. Quite frankly, I'm over them after 17 years. Yeah. And, you know, I just would say, you know, the community did not want a soap opera of a by-election. That's the last thing they need at this time in the southeast. They've got so much on their plate. And those people who are struggling with fires, those who are trying to withstand the COVID impacts, the last thing we needed was mess. And I'm not going to play my part in that.
All right, I'll leave it there. Thanks very much for your time, Minister, and good luck with the weeks and months ahead.